So this report is about trying to understand what those services look like and trying to make suggestions for improvement in terms of safety, sustainability or resilience of a service. The report is an excellent start. It gives us the first answers onto a long journey. There's still clearly a lot more work to be done. But what it really does make very clear to us is the imperativeness that we work collaboratively together, the way that we can share common protocols and processes throughout the whole region so that we can decrease variance of clinical practices and standards. It gives us a very good way and points us to how we can use staff more collaboratively on a networked approach, and gives us some frameworks for doing that. And I think there's a lot we can do with that. Clearly, where that's not possible, we have to look at areas where there are rooms for further change. But for me, the report quite clearly demonstrates that there's a lot we can do with transformation before we can do anything. Well, it's a long report. I think people have to receive it and digest it and read it. It's also going to be shared widely, both with patients, publics, and staff and board members and so on and so forth. But I think we need to take this report and see how we're going to take it forward. I think there are some things we can sort of get on and do now that it makes. We don't need to wait to say actually getting common protocols and processes aligned across the system is quite a good idea, so we should get on and do that. And it also gives us a way of how we need to plan to deliver services in the future. If there is anything that we can't do by the transformation, then we need a process in place to actually get to more specifics about any sort of reconfiguration needs to be done, if any. I think we've made it very clear, even when we were commissioning the report, that we want a district general hospital in every place. It means that the 5 services that we looked at, we're trying to improve them in terms of sustainability and resilience. So this doesn't mean that any services are closing. It means they've got to be networked a bit better. It means we're going to have to use staff a little bit more efficiently, but we want to actually be committed to actually providing these services in all places. No, it's not about saving money. I think this is the first time in my lifetime where any change or anything that's proposed is looking across the whole health and social care system. I've been a consultant since 1993. I started practicing in '83, and medicine has changed massively since then, with technology and expectations and patient numbers and people getting older and people surviving longer. But yet the infrastructure of the healthcare system, both in primary care, secondary care, mental health and social care, hasn't fundamentally changed over 50 years. So the integrated care system is about looking at what that system looks like for the 21st and 22nd century, and the hospital services review is about a part of that. The workforce is our biggest issue, and in fact we need more staff, not less staff. If you're looking at some of the services where there is a shortage of staff, we can use those more efficiently, and we can use other staff to help them in their supporting roles. So this is not about anybody losing their job. This is about different ways of working potentially, but also more staff to be able to support them. Take primary care, for instance. The roles of pharmacists and physicians associates and advanced nurse practitioners there is well established, and that's the sort of thing we should be thinking about to support both primary and secondary care in hospitals and mental health in the future.